All right, today we are talking about a piece of technology that is completely changing the game for how we diagnose heart disease. Let's get right into it. This is the story of the first ever fully autonomous 3D cardiac AI to get the green light from the FDA, a massive moment that went down in 2026. But, to really get why this is such a huge deal, we've got to start with a number: 15 to 20%. Just let that sink in for a second. What on earth could that represent in the world of cardiology? Well, that number, that's the staggering rate of misdiagnosis. For years, that meant that up to 1 out of every 5 patients dealing with a complex heart condition was getting the wrong diagnosis, or just as bad, having their treatment dangerously delayed. We're talking about weeks of gut-wrenching anxiety, unnecessary invasive surgeries, and in the most tragic cases, fatal outcomes. All because the picture just wasn't clear enough. And that gets right to the heart of the problem, doesn't it? It's all about perspective. For far too long, the way we've been looking at the heart, this amazing, complex, three-dimensional engine, has been, well, fundamentally flat. See, here's the disconnect. On the one hand, you have the old way, 2D scans. Cardiologists, brilliant as they are, had to manually piece together a 3D picture from hundreds of flat images. It's an incredibly tough job, and it meant tiny but deadly plaque could be missed, often leading to risky exploratory procedures just to find an answer. But what patients and doctors actually need, that's a whole different story. We need pinpoint accuracy, the ability to spot risks early, and getting fast, reliable answers without all the waiting and the physical toll. And that is where this 2026 breakthrough just blows the doors off everything. We're not just talking about a small upgrade here. This is a seismic shift in how we see, how we understand, and how we diagnose what's happening inside the human heart. So what is this thing really? It's this incredible software approved by the FDA that takes the usual scan data and then all by itself builds this dynamic, interactive 3D map of a person's heart. It's so powerful that it can spot those microscopic bits of plaque that used to be invisible. And the best part? It does all this without a single invasive catheter ever touching the patient. Now, it's really easy to hear AI and immediately think it's coming to replace doctors, right? But that's a huge misconception. The best way to think about this technology is as a second set of flawless eyes. It does the heavy lifting, analyzing millions of data points in seconds, which frees up the human doctor to do what only they can do: talk to the patient, build a plan, and practice the real art of medicine. Okay, but look, a claim that revolutionary needs some serious proof to back it up. So let's dig into the hard data, the science from the landmark clinical trial that actually convinced the FDA to give this its official stamp of approval. Here it is, the number that changes everything: 99.2%. Seriously, in the medical world, a number this close to perfect is, well, it's almost unheard of. It represents a whole new level of certainty. So what that actually means is its sensitivity. Basically, its ability to correctly spot the disease when it's there. And this isn't just some company's claim. This result was published after intense peer review in the New England Journal of Medicine, which is pretty much the gold standard for medical research. It doesn't get more credible than that. And when you see it laid out like this, the difference is just staggering. The traditional methods, they hovered around 80, maybe 85% accuracy, which is good, but it still leaves that dangerous 15 to 20% window of uncertainty we started with. This 3D EI, it slams that window shut, taking us to near perfection and setting a completely new standard of care. It's super important to realize this didn't just appear out of nowhere. The FDA has been on this careful, deliberate path with medical AI for years. It kicked off way back in 2018 with tools for other conditions. Then we saw a bunch of simpler 2D heart AIs get cleared. By 2024, the FDA had to create even stricter rules. So this 2026 approval, it's the result of almost a decade of careful, safety-first innovation. But look, the numbers and the data, that's only half the story. Anytime you start talking about putting AI into our healthcare, you have to talk about the people, the ethics, the doctors, and the patients. I absolutely love this quote from Dr. Sarah Chen over at Johns Hopkins. She makes the point that the AI's real magic isn't just its accuracy, it's the time it gives back to doctors. Time to actually sit with a patient, to hold their hand, to explain what's happening. Time to practice the art of medicine, not just the science. And that leads us to maybe the single most important question you can ask about any medical AI. Is it fair? Is it unbiased? A tool is only as good as its ability to work for everyone. And we know that heart disease looks different in different people, across races and genders.
So how do we make sure the AI doesn't just learn our old biases?
Well, the answer comes down to some really tough regulations. The FDA's algorithmic transparency mandate from 2026 is a big one. It's not a suggestion, it's a rule. Before any AI can get approved, its creators have to prove, with data, that it was trained and tested on a truly diverse population. This ensures from day one that the tech is built to be fair and effective for everyone.
Okay, so let's bring all of this home. Let's make it practical. With this tech out in the wild, what does it actually mean for you or for someone you love when you walk into a hospital? How do you even navigate this new world? Here are 4 key things you can do to be your own best advocate. First, just ask. Ask your doctor about non-invasive 3D AI screening options. Second, find out if your hospital has adopted what they call AI-first protocols. Third, and this is a big one, talk about what it means for billing and insurance. And finally, always remember that this is a tool to help your human care team. It's about collaboration, not replacement.
And that leaves us with this final massive question to chew on. This technology, it's about so much more than just the heart. It points to a future where we can see our own health with a kind of clarity that used to be science fiction. So the real question isn't just what the AI can see inside of us, but how having that vision will fundamentally change the practice and the very soul of medicine itself.